Have you ever heard the saying, "What helped you yesterday may hurt you today"? That's not just a life lesson. It applies to health too. Welcome to hypnotherapy, the place where we explore the truth about your health, beyond the surface. We ask the questions most people are too scared to ask. And we say the things others are too afraid to say. Today, we're talking about something you've likely never been told. There are some routine health checkups that, after a certain age, especially after 70, may actually do more harm than good. Shocking, right? We've been trained to believe that more testing means more safety. That if we catch things early, we can prevent everything. That if we skip a test, we're putting ourselves in danger. But what if some of these tests lead to false positives, unnecessary surgeries, anxiety, radiation exposure, and in some cases, even reduced quality of life? We don't say this to scare you. We say this to empower you. Because after 70, the body becomes more sensitive. The immune system responds differently. Recovery becomes slower. And not every procedure or scan is worth the risk. Now listen closely. We are not saying never go for checkups. We are not saying ignore symptoms. We are saying know what to avoid unless it's truly necessary. And know when routine may no longer be right for you. In this video, we'll walk through 5 of the most common medical tests that people over 70 are still being pushed to take, even when the risks are greater than the benefits. And don't worry, we're not just naming the tests. We'll break them down. We'll explain what they're for, why they were helpful before, and what can go wrong now that you're older. This is about smart healthcare. Healthcare that is personalized, not pressured. Healthcare that protects you, not punishes you. So, sit back, grab a pen, or just listen closely. Because by the end of this video, you'll know what to question, what to avoid, and what to talk to your doctor about. Let's begin with the first test that might be doing you more harm than good. Let's begin with one of the most talked about and most misunderstood tests out there. The colonoscopy. Now don't get it twisted. A colonoscopy can be a life-saving procedure. It helps detect colon cancer early. It removes polyps before they become dangerous. And for younger adults or high-risk patients, it can be incredibly valuable. But here's the truth they don't always tell you. After age 70, especially if you've had previous clean results, this test might not be worth the risk.
Why?
Because a colonoscopy is not a simple test. It involves sedation, bowel prep, and often a hospital visit. And for someone in their 70s or older, these steps can trigger serious complications like dehydration, dizziness and falls, bleeding, and even damage to the colon wall. Studies show that the likelihood of finding aggressive cancer after 75 drops dramatically, but the risk of side effects climbs sharply. So if you've already had regular colonoscopies in your 50s or 60s, and they were normal, there's often no need to continue, unless your doctor finds a new reason to. Even the United States Preventive Services Task Force recommends stopping routine colon cancer screening after age 75 for most people. Here's something else to think about. The mental and emotional stress. Waiting for results, worrying about false alarms, undergoing follow-ups that may never have been needed. It's a heavy burden, especially when your body is no longer able to bounce back like it used to. So what should you do? Heavy checkmark, talk to your doctor. Heavy checkmark, ask whether continued screening is truly necessary for your case. Heavy checkmark, and remember, saying no to a test doesn't mean giving up. It means choosing wisdom over worry. At hypnotherapy, we believe in age-appropriate health, not just health for the sake of habit. And now, let's move to the second checkup on our list, one that millions of older men are still told to take, even though it's no longer always the best choice. Now let's talk about a test that's become almost a ritual for men over 50. The PSA test, for prostate cancer. It sounds simple. A blood test that checks for prostate problems. Quick, easy, painless. What could go wrong, right? Here's what they don't often say. The PSA test is not a cancer test. It simply measures the level of a protein in your blood called prostate-specific antigen.
And yes,
high PSA levels can mean cancer, but they can also mean a swollen prostate, a recent infection, or even a normal change due to aging. This means many men get alarming results that turn out to be false alarms. But once that number is high, the real stress begins. Doctors may rush into biopsies, which are painful, carry risks of bleeding and infection, and can even lead to treatments like surgery or radiation, even if the cancer was slow-growing and never going to cause harm. Here's what most people don't realize. After age 70, most prostate cancers grow so slowly, they'll never cause problems in your lifetime. Yet the treatment side effects, like incontinence and sexual dysfunction, can deeply affect your quality of life. Imagine being treated for something that would never have harmed you, and ending up worse than before. That's why more and more experts now say, PSA screening after age 70, especially without symptoms, is often unnecessary. And in men over 75? The risks often outweigh the benefits. So what should older men do? Talk to your doctor. Ask if you have risk factors like family history or urinary issues. And if you don't, consider skipping the test. Remember, at this stage in life, it's not just about finding disease. It's about avoiding harm from the search. You are not your PSA number. And you don't need to chase problems that may never affect you. Let's move on to point 3. A test that millions of older women still do every year, even when it may no longer be needed. Now, let's talk about something that sounds futuristic. Something that seems like a shortcut to peace of mind. The full body scan. These days, they're everywhere. Private hospitals promote them. Celebrities endorse them. They promise to catch diseases early, sometimes even before symptoms show up. And sure, that sounds amazing. Especially as we get older. We think, why not scan everything just to be sure? But here's the truth. Full body scans are not magic. And for people over 70, they may do more harm than good. Let's break it down. A full body scan usually involves either a CT scan or an MRI. These tests look at your organs from head to toe, your lungs, liver, kidneys, heart, bones, and more. And yes, they can sometimes catch serious conditions. But far more often, they find incidental findings. That means spots, nodules, or shadows that look suspicious, but turn out to be harmless. Still, once something shows up on the scan, doctors have no choice but to investigate further. This often leads to repeat scans, biopsies, invasive procedures, and enormous amounts of stress. And here's the kicker. Some of these follow-up procedures come with serious risks, especially for someone over 70. Sedation, bleeding, infection, hospital stays, even emotional distress that lingers for weeks or months. And all of this, for something that might never have caused a single problem. Let's not forget the radiation exposure from CT scans. One scan may not be much, but multiple unnecessary scans over time can slightly raise your cancer risk. Yes, you heard that right. The test that's supposed to protect you can actually add to your risk. So here's the bottom line. Heavy checkmark if you have no symptoms. Heavy checkmark if your doctor hasn't ordered a scan for a specific concern. Heavy checkmark if you're feeling okay and just want peace of mind. Think twice before getting a full body scan, especially from private companies trying to sell it as a package. Because more information isn't always better. Sometimes, it's just more confusion. And at this stage of life, peace, clarity, and balance are more valuable than chasing invisible threats. Don't get tested out of fear. Make decisions from a place of wisdom and calm. At hypnotherapy, we always say, protect your peace, not just your body. Let's now shift our focus to women. Specifically, one of the most routine tests many women feel obligated to do, year after year. The mammogram. For decades, women have been told, get your mammogram yearly. Catch breast cancer early. Don't skip it, it could save your life. And in many cases, especially between the ages of 40 and 69, that's true. Mammograms can detect tumors early and lead to better treatment outcomes. But after the age of 70, especially after 75, the story begins to change. Here's why. Most breast cancers in older women grow very slowly. So slowly, in fact, that they may never cause symptoms or shorten your life. And yet, the mammogram still detects them, which leads to more tests, more biopsies, more surgeries, and in some cases, radiation or chemotherapy that may not have been needed at all. Let's be clear. We are not saying breast cancer is harmless. We are saying that for many older women, the treatment becomes more dangerous than the disease itself. Because at this age, your body is more fragile. Recovery is harder. And the stress of the process can affect not just your body, but your mind and your peace of mind. Also, mammograms are not perfect. They can miss some cancers. And worse, they can detect false positives, shadows or cysts that look suspicious, but turn out to be nothing. Still, the panic that follows, the sleepless nights, the fear of the unknown, can take a heavy emotional toll. So what's the current expert advice? Many health organizations now say, if a woman is over 75, and she has no family history of aggressive breast cancer, and no current symptoms, she may no longer need regular mammograms. Instead of automatic yearly screenings, it becomes a personal choice, based on your health, history, and values. So before scheduling your next mammogram, just because, ask yourself, is it for your benefit, or out of habit? And talk with your doctor. Ask whether continuing screening will actually improve your quality of life, or just lead to more procedures with little gain. At Hypnotherapy, we believe in smart screening, not automatic screening. Your body, your choice, your peace. Now let's talk about a test that's been a part of almost every woman's life since her 20s or 30s. The Pap smear. This simple test checks for early signs of cervical cancer. And it's one of the reasons deaths from cervical cancer have dropped significantly in the past 50 years. But what if I told you that once a woman reaches a certain age, this test may no longer be needed? Yes, you heard that right. Here's what the research says. If you are over 65 or 70, and you've had normal Pap smear results for the last 10 years, and you've never had cervical cancer or high-risk HPV, you likely don't need another Pap smear again, ever. Why? Because cervical cancer develops very slowly. In many cases, it takes 10 to 20 years to turn from an abnormal cell to something dangerous. By the time a woman is in her 70s, if she's had a long history of normal results, the chance of suddenly developing cervical cancer is extremely low. So continuing Pap smears at this age may lead to false positives, unnecessary biopsies, or painful follow-ups, and emotional stress that could have been avoided. And let's not forget, for older women, Pap smears can feel more uncomfortable due to natural changes in the body after menopause. The exam can become invasive, painful, and even distressing. So what should you do? If you're over 70, if you've had normal results for a decade, and if you have no history of high-risk HPV or cervical issues, talk to your doctor. Ask if this test is truly still needed for you, or if it's time to say, I'm done. Because sometimes, stepping away from a test is not neglecting your health. It's trusting your history, your body, and the wisdom that comes with age. At Hypnotherapy, we believe that healthcare in your 70s should be gentle, intentional, and respectful of your journey. Now that we've explored all 5 tests, let's bring everything together with a closing message you don't want to miss. And there you have it. 5 common health checkups that, after the age of 70, may no longer help you, and in some cases, may quietly cause you harm. Let's quickly recall what we've discussed today. Colon cancer screenings that may lead to dangerous complications in older bodies. Prostate cancer tests that can result in unnecessary fear and invasive treatments. Mammograms that may detect slow-growing cancers that never needed treatment. Pap smears that might no longer serve a purpose after a lifetime of clean results. And full body scans that can lead you down a path of confusion, stress, and overtreatment. Each of these tests had value, once. Each of them may still be useful, in the right situation. But what matters now is understanding that your body at 70 is not your body at 40. Medicine should not be automatic. It should be personal. And it should be gentle with aging bodies that deserve care, not chaos. You are not weak for saying no to unnecessary tests. You are not lazy for refusing fear-based medicine. You are wise. You are experienced. And you deserve healthcare that honors your season of life. So before you sign up for that next screening, ask the question, will this help me, or will it just stress me? And most importantly, Have that conversation with your doctor. Not out of fear, but from a place of self-respect, wisdom, and peace. Thank you for spending this time with us on hypnotherapy. If you found value in this video, please take a moment to like, comment, and share it with someone you care about. Let's help more seniors make informed, empowered choices about their health. Don't forget to subscribe for more voice-guided health insights, stories that heal, and facts that bring peace, not panic. Until next time, stay calm, stay informed, and stay well.